Good morning, everyone, and welcome to our training session for TB and HIV focal persons. Today, we're focusing on TB infection prevention and control, or TBIPC. This is an important step in strengthening our response to these health challenges. Over the course of this presentation, we'll cover key strategies, best practices, and practical approaches to improve infection control in our regions. I'm glad to have you all here, and I look forward to an engaging and productive session. Now, let's discuss how TB is transmitted in health facilities. Understanding this is crucial because it helps us identify where the risks are and how we can prevent the spread. TB primarily spreads through the air when an infectious person coughs, sneezes, or talks, releasing tiny droplets that can be inhaled by others nearby. In health settings, crowded spaces, poor ventilation, and close contact can increase the risk of transmission. Next, I want to introduce the 3 levels of TB infection prevention and control, or TBIPC measures. These are essential strategies that we can implement at different stages, ranging from administrative controls, which involve policies and procedures, to environmental controls like ventilation improvements, and finally personal protective measures, such as the use of masks. Each level plays a vital role in creating a comprehensive approach to reduce TB transmission. We also need to recognize that there are gaps in infection prevention and control, especially in TB and HIV clinics. These gaps might include inadequate screening procedures, poor ventilation, or inconsistent use of protective equipment. Identifying these weaknesses is the first step toward addressing them. Finally, I want to emphasize that implementing practical TBIPC actions in our facilities is both achievable and essential. This can involve simple measures like improving airflow, ensuring staff wear masks, or establishing clear screening protocols. When we take these steps, we not only protect our patients and staff, but also strengthen our overall infection control efforts. Remember, effective TBIPC is a shared responsibility that requires our ongoing attention and commitment. Tuberculosis, or TB, spreads primarily through the air, which means it can be transmitted easily when an infectious person coughs or sneezes. That's why health facilities are considered high-risk settings for TB transmission. These are places where many people come together, often with weakened immune systems or other health issues. People living with HIV, or PLHIV, are especially vulnerable because they are more likely to develop active TB if exposed. This makes protecting them a top priority. Similarly, health workers are at an increased risk of TB infection because they're in close contact with patients who might be infectious. This is where TB infection prevention and control, or TBIPC, comes into play. It's essential because it helps protect not just the patients, but also visitors and staff. When we implement effective TBIPC measures, we create a safer environment for everyone in healthcare settings. So, understanding and prioritizing TBIPC is a crucial part of controlling and preventing TB transmission in our facilities. Now, let's talk about how TB spreads from one person to another. When someone with pulmonary TB coughs, sneezes, or even talks, tiny droplets containing the bacteria are released into the air. These droplets can stay suspended in the air, especially in poorly ventilated rooms, making it easier for others to breathe them in. This is particularly concerning in high-risk areas such as outpatient department waiting areas, HIV clinics, TB clinics, and laboratories. These are places where many people gather in close proximity, which increases the chance of transmission. Understanding how TB spreads in facilities highlights the importance of good ventilation and infection control measures. It's essential for us to be aware of these risks so we can implement strategies to protect ourselves and others from infection. Let's take a closer look at the different levels of infection prevention and control, or IPC, for TB. First and foremost, the most important aspect is administrative control. This involves establishing policies and procedures to reduce exposure and ensure staff and patient safety. It's about creating a strong foundation through effective management and protocols. Next, we have environmental control. This includes measures like proper ventilation and the use of UV germicidal irradiation to reduce the concentration of infectious particles in the air. These controls are vital in minimizing the risk of airborne transmission in healthcare settings. Then we come to personal protective equipment, or PPE. Proper use of masks and respirators is crucial for individual protection when interacting with potentially infectious patients. PPE acts as the last line of defense, so its correct and consistent use is essential. Finally, understanding the different levels of TB infection helps us tailor our IPC strategies effectively. These levels guide us in implementing the appropriate controls depending on the setting and the risk involved. Altogether, these layers of control work synergistically to protect both healthcare workers and patients, reinforcing the overall theme of comprehensive TB infection prevention. So let's talk about what administrative controls are. Essentially, these are policies and procedures put in place to reduce exposure to tuberculosis. They serve as the first line of defense by establishing clear guidelines for managing TB within a healthcare or community setting. The main goal here is to identify TB patients as early as possible, separate them from others to prevent transmission, and ensure they receive appropriate treatment quickly. This approach helps contain the spread before it can happen, protecting everyone involved. By focusing on these administrative measures, we're creating a safer environment and supporting the overall effort to control TB. It's about proactive management, being vigilant, organized, and swift in our response. This is a crucial part of the broader infection control strategy, linking to the importance of timely detection and treatment that we've discussed earlier. Let's start by emphasizing the importance of screening all patients for cough as part of our triaging process. This simple step helps us identify potential TB cases early on. Once we identify coughing patients, we need to separate them from others to prevent transmission. Fast-tracking presumptive TB patients is crucial. This means prioritizing their diagnosis and ensuring they get tested and started on treatment as quickly as possible. Early diagnosis and treatment are key to controlling the spread and improving patient outcomes. We also have to educate patients on cough etiquette, like covering their mouth and nose and proper disposal of tissues, to reduce the risk of spreading TB. Lastly, training our health workers on TB infection prevention and control measures is vital. This ensures everyone understands how to implement these practices effectively, creating a safer environment for both patients and staff. All these measures together form a strong administrative framework that supports our overall goal of TB control and patient safety. Now let's talk about TB screening at entry. When patients come in for triage or registration, it's important to ask them a few key questions. First, do they have a cough? Cough is a common symptom we look out for. Next, we ask about fever, since it often accompanies TB. We also inquire if they experience night sweats, which can be a sign of TB infection. And finally, we ask about unexplained weight loss, another important indicator. The most critical point here is that if anyone reports having a cough, they should be masked immediately. Additionally, they should be fast-tracked for further evaluation. This helps us quickly identify potential TB cases and ensure they get the attention they need while minimizing the risk of transmission to others. This process is an essential part of our overall TB control strategy, aiming to catch cases early and prevent spread within the community. When it comes to patients with cough, it's really important to manage their care quickly and efficiently. First, these patients should be seen as soon as possible to minimize the time they spend waiting around. This helps reduce their exposure to others, especially in busy waiting areas. Next, we want to ensure they spend less time in those waiting areas altogether. The goal is to limit their contact with other patients and staff who might be at risk. Additionally, directing cough patients to well-ventilated spaces is crucial. Good ventilation helps disperse infectious particles, lowering the chance of transmission. All of these steps, seeing them quickly, minimizing their time in waiting zones, and ensuring they're in well-ventilated areas, are part of a broader strategy to protect everyone. This approach is especially important for fast-tracking TB patients, because TB is highly contagious, and quick, Targeted actions can really make a difference in controlling its spread. When it comes to separating patients, it's really important to minimize the risk of infection transmission. Where possible, we should aim to have separate waiting areas for patients who are coughing or showing respiratory symptoms. This helps prevent the spread to other patients who might be asymptomatic or less vulnerable. If outdoor waiting areas are an option, they are actually preferred because they allow better ventilation and reduce the chance of indoor contamination. Additionally, maintaining a safe distance between patients in all waiting areas is crucial. Even simple measures like spacing chairs apart can make a significant difference. Overall, these strategies are about creating safer environments and protecting both patients and staff by reducing close contact and potential exposure. When a patient presents with a cough, it's crucial to collect sputum samples in a designated sputum collection area to ensure proper handling and testing. This helps us accurately diagnose TB and prevent cross-contamination. The diagnostic test for TB should ideally be done right here on-site at the hospital, but if that's not possible, we can refer the patient to the nearest laboratory that has the gene expert site. This rapid testing is essential for timely diagnosis. For all patients showing TB symptoms, we should offer provider-initiated counseling and testing, or PICT. This approach helps us identify TB cases early and provides the necessary support and information to the patient. Once the tests are done, it's important to follow up on the results within 2 days, so within 48 hours, to ensure we're not delaying treatment. Early diagnosis and prompt treatment are key to controlling TB effectively. By doing this, we not only improve patient outcomes, but also help prevent the spread of TB within the community. Today, I want to talk about the purpose of environmental controls in managing TB. The main goal here is to reduce the concentration of TB bacteria in the air, which is crucial for preventing transmission. The primary method we use to achieve this is ventilation. By ensuring proper airflow, we can dilute and remove contaminated air, making the environment safer. Environmental controls are a key part of infection control strategies, and understanding their role helps us protect both patients and healthcare workers. So, remember, effective ventilation is central to controlling TB in any setting. So, the main purpose of environmental controls in this context is to reduce the concentration of TB bacteria in the air, and the most effective way to do that is through ventilation. Now, when we talk about ventilation, natural ventilation is often the best and most affordable method we have. This involves simple actions like opening windows and doors to allow fresh air to flow through. Creating cross-ventilation by opening windows on opposite sides of a room can really improve airflow and dilute any bacteria present. Whenever possible, using outdoor spaces for activities can also help reduce the risk. Remember, rooms should never feel stuffy. Good airflow keeps the environment healthier for everyone. Ultimately, by focusing on natural ventilation, we can make a significant difference in controlling TB transmission in various settings. Now, let's talk about mechanical ventilation where it's available. One of the key aspects is the use of fans to improve air movement throughout the space. Proper airflow helps dilute and remove airborne contaminants, which is crucial for maintaining a safer environment. In addition, exhaust fans play a vital role by actively pulling out contaminated air from the room, ensuring that harmful particles don't linger and spread. This creates a sort of controlled airflow that directs potentially infectious aerosols away from people and out of the space. Another important measure is the installation of UV lights, specifically upper room UVGI systems. These ultraviolet germicidal irradiation systems are installed at higher levels, where they can inactivate pathogens in the air without exposing occupants directly to UV light. All of these strategies, fans, exhaust systems, and UV lights, are part of a layered approach to improve indoor air quality and reduce infection risk. When combined with other controls, they significantly enhance our ability to keep indoor environments safer. Let's talk about protection for patients, especially those who are coughing. It's important that coughing patients wear a surgical mask to help contain any droplets that could spread infections. They should also make a habit of covering their mouth whenever they cough, whether with a tissue or their elbow, to minimize the risk to others. Additionally, educating patients on cough hygiene is crucial. Teaching them about proper coughing techniques and the importance of hand hygiene can make a big difference in preventing the spread of illnesses. All of these steps, mask wearing, covering the mouth, and education, are key components of personal protection. They not only protect other patients and staff, but also help create a safer healthcare environment for everyone. Remember, these simple practices are vital parts of infection control and our overall goal of ensuring patient safety. When it comes to protecting our health workers, especially those working in high-risk areas, it's crucial to use the right protective equipment. In these settings, N95 or FFP2 respirators are essential. They provide a high level of filtration, helping to prevent the inhalation of infectious particles. Particularly in places like TB clinics, sputum collection areas, and MDR-TB wards, the risk of airborne transmission is higher. That's why wearing these respirators consistently and correctly is so important. It's about safeguarding not just the health workers, but also ensuring the safety of everyone around them. Remember, using proper protective equipment is a key part of our overall infection control strategy. It helps us reduce transmission and protect those on the front lines of care. Now, let's talk about the proper use of the N95 mask. First, it's essential that the mask fits tightly on your face to ensure maximum protection. A good fit means there are no gaps between the mask and your skin. Next, you want to make sure it covers both your nose and mouth completely. This coverage is critical for preventing airborne particles from entering. It's also very important not to touch the front of the mask while you're wearing it. The front can be contaminated, so avoid adjusting or touching it unnecessarily. And if the mask becomes wet or damaged, don't keep using it. Replace it immediately. A compromised mask won't provide the protection you need. Remember, following these steps is vital for safety and helps us all stay protected, especially when we're in high-risk environments. Proper use of the mask is a key part of our overall infection control strategy. Now, let's talk about why TB-IPC, or tuberculosis infection prevention and control, is so critical in HIV clinics. First, people living with HIV, or PLHIV, are especially vulnerable to TB. Their immune systems are often weakened, making it easier for TB to take hold. This vulnerability really underscores the importance of strict infection prevention measures. Next, it's important to remember that TB is a leading cause of death among PLHIV worldwide. In fact, protecting these patients from TB isn't just a matter of good practice, it's a lifesaver. That's why every HIV clinic must apply TB-IPC measures rigorously. We can't afford to be complacent, because the health and lives of our patients depend on it. Implementing effective TB-IPC is a key part of providing comprehensive, safe care for people living with HIV. Now, let's talk about the key actions we should focus on in HIV clinics to effectively manage TB. First, it's crucial that we conduct TB symptom screening using AI-powered X-ray analysis at every visit. This helps us identify potential TB cases early. Next, we need to prioritize fast-tracking patients who are coughing and living with HIV, ensuring they get prompt attention. Ensuring good ventilation within the clinic environment is also vital, as it reduces the risk of TB transmission. Early TB testing is essential, and using rapid tools like GeneXpert allows us to diagnose quickly and accurately. Lastly, if a patient is diagnosed with TB, we must start treatment immediately to improve outcomes and prevent further spread. These actions are interconnected and form a comprehensive approach to better care and control of TB among our patients. Let's talk about the facility TB-IPC plan. It's essential that every facility has a clear and effective plan in place. First, each facility should designate a TB-IPC focal person, someone responsible for overseeing infection prevention and control related to TB. This person becomes your go-to for implementing and monitoring the plan. Next, having a written TB/IPC plan is crucial. It provides a structured approach and ensures everyone knows their roles and responsibilities. Without a written plan, efforts can become disorganized, so make sure it's documented and accessible. Regular staff training is also key. Continuous education helps staff stay updated on best practices for TB infection control. Along with training, staff screening is important to identify potential TB cases early and prevent transmission within the facility. Finally, routine supervision helps maintain quality and accountability. Regular checks ensure that infection control measures are being followed properly and allow for ongoing improvements. Putting all these elements together creates a strong facility TB/IPC program, one that protects both staff and patients and helps us move closer to ending TB transmission. Now, as TB and HIV focal persons, you have a crucial role in ensuring effective infection prevention and control. Your responsibilities include making sure that TB screening is consistently done for everyone, which helps with early detection and treatment. You also need to monitor ventilation practices within your facilities, because good airflow significantly reduces the risk of TB transmission. It's equally important to ensure that masks are always available for staff and patients, as proper use of masks is a key protective measure. Supporting staff on IPC practices is another vital aspect. This means providing guidance, training, and support to keep everyone informed and protected. Lastly, you are responsible for reporting TB cases among health workers, which helps us understand the scope of the issue and improves our overall response efforts. Remember, your role ties directly into the larger goal of reducing TB transmission in healthcare settings and protecting both staff and patients. Your leadership and vigilance make a real difference in creating safer health environments. Let's talk about monitoring TB/IPC, or tuberculosis infection prevention and control, to make sure our measures are effective. First, it's important to check regularly, so ask yourself, are the windows open? Proper ventilation is key to reducing the risk of airborne transmission. Next, consider if coughing patients are being fast-tracked. That helps limit their exposure to others while they wait for care. Also, are staff consistently using N95 masks in high-risk areas? Personal protective equipment is crucial for our safety. Lastly, ensure that TB screening is documented properly. Keeping accurate records helps us track cases and evaluate our infection control efforts. By staying vigilant with these checks, we strengthen our overall TB/IPC strategies and protect everyone in the facility. Let's take a closer look at some common gaps we often see in facilities. First, overcrowded waiting areas can really pose a challenge, making it difficult to maintain proper social distancing and increasing the risk of transmission. Next, closed windows might seem like a good idea for security or climate control, but they can reduce ventilation, which is crucial for dispersing airborne pathogens. We also see some facilities lacking cough triage, meaning there's no specific process to identify and manage patients with respiratory symptoms early on. Along with that, there's often no separation of coughing patients, which can allow infectious droplets to spread more easily within the facility. And finally, staff not using respirators when appropriate is a significant gap. Protecting healthcare workers is essential, and proper PPE use is a key part of that. These gaps highlight areas where we can improve our facility protocols to better protect both patients and staff, aligning with our overall goal of creating safer healthcare environments. All right, let's look at some practical, low-cost improvements we can implement to enhance safety and reduce the risk of infection transmission. First, simply opening windows daily can really improve ventilation, helping to disperse airborne particles. Moving the waiting area outdoors is another great option, especially when weather permits, because outdoor air significantly reduces the concentration of pathogens. Next, putting up cough posters is a simple but effective reminder for everyone to cover their mouth and nose when coughing or sneezing, which helps prevent the spread of germs. Providing masks at triage ensures that anyone showing symptoms can quickly get a mask, protecting both staff and other patients. And finally, prioritizing coughing patients means giving them immediate attention to minimize their contact time with others, which is especially important during peak times. These small adjustments are affordable, but can make a big difference in creating a safer environment and supporting our overall infection control strategies. Let's take a moment to emphasize some key messages. First, TB spreads through the air, so ventilation really matters. Good airflow helps reduce the concentration of infectious particles, making the environment safer for everyone. Next, early identification of patients who are coughing is absolutely critical. Catching TB cases early allows us to take swift action and prevent further transmission. Administrative controls are the most important part of TB infection prevention and control. These include policies and procedures that help us minimize exposure, such as screening protocols and patient management strategies. Remember, TB/IPC measures are essential to protect not only staff, but also our most vulnerable patients. Finally, dedicated roles like TB and HIV focal persons, along with the IPC committee, play a vital leadership role. They lead the implementation of infection prevention and control strategies within the facility, ensuring that these practices are consistently followed and adapted as needed. All of these elements together form a comprehensive approach to reducing TB transmission in healthcare settings. Now, I'd like to open the floor for discussion and questions. What TB/IPC challenges are you facing in your facility? Think about the specific obstacles your team encounters when trying to implement or maintain infection prevention and control measures. Are there resource limitations, staffing issues, or perhaps difficulties in ensuring proper patient management? It's important to share these challenges so we can learn from each other and explore potential solutions together. Remember, understanding these real-world barriers is a key step towards strengthening TB/IPC practices across all settings. So please feel free to speak up and let us know what's been working and what's been difficult in your context. This slide doesn't contain enough information. That's why we're moving to the next slide. Thank you so much for your attention. I really appreciate your time and engagement throughout this presentation. I hope the insights shared today have been helpful and inspiring for your own work. Remember, the key takeaways are all about applying these concepts effectively and continuously striving for improvement. If you have any questions or want to discuss further, please don't hesitate to reach out. Thanks again, and I look forward to connecting with you all soon.